Hi students, today we're looking at a video introduction to Chapter 5. Chapter 5 is Informed Consent. We are talking about decision-making capacity, making sure folks have the ability to make a rational decision. Some key terms are competence, informed consent, therapeutic privilege, and waiver. The classic case file for this chapter is a Jerry Canterbury, and that's a famous one, and it's important to be familiar with it. Let's take a look at the chapter. So, informed consent is something that's directly related to patient autonomy. Autonomy, folks have the right to make the decisions about their lives. They can't be used, taken advantage of, treated like objects. And also, keep in mind this has a direct link to Kantian ethics. Kantian ethics, we have a responsibility regarding how we treat people. We can't use them. Patients and people in general have the right to autonomy, and informed consent has everything to do with autonomy. People have to have the ultimate say in what's done to their bodies. They cannot be treated without their voluntary and informed agreement. And honoring this principle means letting patients voluntarily choose, even when their choices conflict with medical advice. Even if the doctor really thinks this surgery is the best thing, you have the right to say, no, I'd rather do it a different way. Now, one of the tricky things is how much information is a doctor required to share? I mean, patients haven't been to medical school, so it's not like they're going to hand you a whole book on surgery. They have to make an appropriate judgment regarding what information needs to be shared and present it in a way that the patient can understand. And Canterbury versus Spence, that's the Jerry Canterbury case that's famous. And the Court of Appeals says the scope of the physician's communication to the patient then must be measured by the patient's need, and that need is the information material to the decision. Needs whatever information is relevant to make an informed decision. One of the things they're worried about is patients are shoved a form, here, sign this. So too often a patient can sign a form disclosing treatment risks and thereby, according to local law and institutional policy, grant her informed consent. But the truth is they might not be informed or autonomous or have consented to anything, because that just because you shove a piece of paper in a patient's face and say sign it, when they sign it, that doesn't mean they understood. It has to be a legitimate informed consent. So they break it down, conditions of informed consent. The patient is competent to decide. Competent, that means that they're not under the influence of drugs, or they don't have a severe psychiatric issue or severe something with their mind that they can't process things. So it has to be competent to decide and then get adequate disclosure, an appropriate amount of disclosure, understands that information, and decides voluntarily. Then there's some of the tricky things. Patients are often judged incompetent if there's an intellectual disability, dementia, psychosis, alcoholism, or it's a little kid, a minority. And when they say minority, they're talking about minority age, like a little kid, in which case someone has to decide to support them, has to decide for them. Sometimes a court will formally determine someone to be incompetent, but most of the time the courts don't get involved. It's decided by the doctors in consultation with the patient's family. Courts and legislatures have generally mandated the disclosure of this. This is a page I went over in class. The nature of the procedure. Is it a test or a treatment? How invasive? How long is it going to go on? What are the risks? And the alternatives. What would happen if you didn't do it? And the expected benefits. What's the purpose of it? Duty of physicians to get informed consent has exceptions. For example, emergencies. Like someone's just been brought into the emergency room and like they're at risk of dying. If they stop to try to explain everything to the patient, the delay would cause too much harm. So those would be moments of exception. Also in the case of a waiver, so the patient voluntarily and deliberately gave up their right to informed choice. Okay, so you're going to be reading more about that. Therapeutic privilege is something that's controversial. That is when therapeutic privilege is when the doctor didn't tell them information because, in the doctor's opinion, telling them the truth would cause them too much harm. They might say something, oh, well, if I tell the patient all the information, they might be too depressed. It could make their condition worse. This one is tricky because we've learned about paternalism when the doctor tries to overrule the patient and be like, I know what's best for you. So that's why it's so controversial. But there are still cases where folks think it's appropriate. Then there's that whole part about decision-making capacity. How do you decide whether or not a patient is competent to have decision-making capacity? Capacity means ability to make decisions. Things to assess. The patient makes and communicates a choice. Patient appreciates, they mean understands. The patient understands medical diagnosis, nature of recommended care, alternatives, what the other options are, risk benefits, things like that. Typically, it's the attending physician who decides whether or not the patient is capable of making decisions. Sometimes the courts get involved. Sometimes psychiatrists might be consulted. And this page we went over in class. These are questions you might ask to try to figure out if the patient has decision-making capacity. For example, you want to make sure they understood the information. So tell me what you believe is wrong with your health right now. That make sure they understand the consequences. All right, I've described the probable benefits and risks. How do you think your daily activities would be affected if these benefits and risks were to occur? Then you want to make sure they're using reasoning, logic to make a choice. Tell me how you reached your decision. Then we talked about mental status examinations. These are done regularly by psychiatrists, but also medical personnel when they're checking in on a patient. Sometimes they'll ask this, tell me where you are right now. Tell me who the president is. What's the date right now? Things like this. Oriented to person, place, and time. They might ask things related to attention span. The psychiatrist might say some words and then ask you to repeat it back, things like that. Okay. Situations. If there's mental illness, schizophrenia, depression, that can affect a patient's ability to understand the information fully and make a rational choice. So they do talk about meeting with a psychiatrist and treating the underlying medical or psychiatric illness before they decide. They also talk about religious beliefs and the impact of that. Okay, there's good articles here. Oh, here they circle back to therapeutic privilege. That's when the doctor is like, oh, I don't need to tell them. I don't need to give them all the information. And critics worry that too many doctors use therapeutic privilege when really they need to tell the patients the facts. These were important cases regarding informed consent. And the famous one that they focus on in this textbook is Canterbury versus Spence. You're going to read about what happened with that. Basically, uh, the doctor recommended a surgery and didn't bother mentioning that he could end up paralyzed if they went through the surgery. And then the guy ended up paralyzed. All right. Now it applies the major theories, utilitarianism, Kantian ethics, goes through it. And now we have the classic case file, page 204. This is the famous one. How much physicians obligated to disclose to patients, what standard. This was a turning point case in 1972. 19 years old, been in pain. They recommended an operation, but he ended up paralyzed from the waist down and sued. So the doctor tried to talk about, oh, therapeutic privilege. I didn't want to worry him. There was just such a low risk of being paralyzed. But no, the judge said, no, that's a paternalistic notion. All right, so keep terms. There's the summary. All right, I'll stop right there.